you want to know what is wrong with the NHS, look no further than here for an example. This was Colindale Hospital, which was a care of the elderly hospital. Now, all that there is here is a lot of fairly high-rise flats. So population density in this area has increased. You've lost a care of the elderly hospital, and there hasn't been any increase in health services in the vicinity to match the population increase and the amount of accommodation increased. And this is just one example in one area. I worked in Norwich as well. There was a new housing, a very big new housing estate going up next to the hospital. The size of the hospital wasn't really increased, and there were no extra hospitals built. So as long as this keeps happening, the NHS is just not going to be able to cope. The amount of money mentioned by Jeremy Hunt as being invested in the NHS is not even going to touch the sides of what you're seeing here, and this is just one example. This is a drop in the ocean of what is actually going on. So what you just saw there is not even the problem. If you look in here, this increase in accommodation is endless. So where is the healthcare capacity to deal with all of this? And there's no point saying it's a bunch of immigrants like overrunning the health service, because it's largely irrelevant who's living in these flats. If they're paying taxes and they're paying council tax, right, that should cover the increased health service provision. So where is all the money going? That's what the real question is.